gentlemen, you are all welcome to this media briefing by the Center for Social Justice, the Nigerian Knowledge Institution, and we are responding to the budget proposals 2018 of the federal government on health generally, with a specific emphasis on maternal, newborn, and child health. Although you may say we've taken some time since the budget was released before we are commenting, we do not rush to make comments on things that require in-depth study and empirical study so that we are well-grounded and make our response based on empirical evidence and a proper analysis of the situation vis-a-vis the challenges we have in the health sector, the epidemiological analysis, the poor condition and stage of maternal, newborn, and child health, the acute morbidity and mortality rates, and poor nutrition and infant status. So that's why we took our time before we came up with this review. The first part of the review detailed key capital projects in maternal, newborn, and child health, and we made some comments about them. Of course, we are doing this to facilitate the legislative approval of the 2018 budget so that the legislature, in their consideration and approval of this budget, will make the necessary amendments, include those votes that are due and constitutional which have been neglected, cut down on frivolities where they exist, and then ensure that we have a much more better budget where Nigerians can follow, not just vague terms which are unclear, that nobody knows exactly the goods, services, or construction that is provided for, or the deliverables at the end of the year. So like I did say, you see the first part of it, where you have the table, you have the code, project name, amount, comments, and then you have NTA by NTA, which run into from page 30 down to page 30 to page 18. So that anybody can look up at his own free time. But let us look at the matters arising from the health through maternal, newborn, and child health funding proposals. The first issue is about inadequate allocation to the health sector and maternal, newborn, and child health. I know this is topical because some of our colleagues who are also critical of the work we do ask that every time we say the money is not enough. If the money is not enough, there's no way we can say it is enough. Because in 2018 budget, out of a budget of 8.612 trillion, the total sum allocated to health is 340 billion 456 million, which is representing 3.95% of the total budget. In 2017, it was 4.15%. So we are in a reverse gear when the challenges facing the health sector has not diminished. And this is not up to 1/3 of 15% of the budget recommended in the Abuja declaration. Although we admit the other health-related expenses in the budget, if you add them all up, everything will come up to 423.569 billion, which is roughly 4.92% of the overall vote. It's still very low, still not up to 1/3. So you see the trajectory of health votes between 2015 and 2018. In 2015, it was 4.13%. In 2016, it improved marginally to 4.15%. And then in 2018, it's coming down to 3.95. The highest was in 2015, followed by 2016, and then 2018 is getting lower and lower. You may say that the money you see in the budget for 2018 is slightly higher than that of 2017, but you know that the overall vote for 2017 was also lower. So you can see the trajectory. So we are moving into retrogression when we should have been making much more votes for the health sector. And I say this because we believe that the president, having his recent experience where Nigerians pay for his healthcare delivery services over 2 or 3 months outside this country, should have had a personal interest in improving healthcare delivery in Nigeria in terms of health infrastructure and general health service delivery. So we are surprised that it did not happen under his watch. We disaggregated this money that has been voted over the years into dollars, considering the volatile and fluctuating nature of our currency. 2015 still had the highest 1.3 billion, 2016 1.2, 2017 1.0, and slightly higher in 2018 1.1. So we are saying this is not enough. And then the Basic Healthcare Provision Fund, which is provided in Section 11 of the National Health Act, which amounts to 1% of the Consolidated Revenue Fund of the Federation, was also missing in the provisions. There was no sign of it. This became law. The National Health Act became law since 2015. And since then, every year, this has been missing from the budget. And then the allocation to vaccines is also poor. And there is silence on the local vaccine production initiative that was started last year. So, if you look at what we provided, this is not enough, considering that we had only 33% immunization coverage, as indicated in the multiple indicator cluster survey, which is the National Immunization Coverage Survey, among children aged 12 to 23 months, as against a global standard of 90%. So it becomes clear that we are not doing enough. And we don't think it makes sense for us to be borrowing money to pay for immunization. It's the height of irresponsibility for any man and woman to bring children in the world that you cannot even cater for at that their primary age of needing immunization. All right? So, if as parents we cannot do that, our government should be able to do it. So, if our government is not able to do it and we are borrowing money or looking up to international donors, that shows we are not civilized and polished enough. Now, in terms of financing primary health care, particularly primary health care centers, we noted the money that has been voted for it this year, though not necessarily enough, and we also noted that in previous years we've been voting money. But what we failed to do is that we are not ensuring that what we are doing is functional. Federal government ideally should have no business in funding primary health care centers. It should be the business of local governments and the state governments. But if the federal government is funding, it's only going to build the capital component. It's only going to build the structures. The federal government is not going to hire and recruit nurses, doctors, and midwives, or do the running expenses of like provision of electricity, paying for electricity, solar energy, buying the things that are needed on a day-to-day basis. So there are many of these primary health care centers that have been constructed and finished, but no service is going on in them across the federation. So we are saying that the federal government should do an MOU with states and local governments, where these PSCs exist now, where they want to sign this, so that there have been an undertaking on the part of the state and local government to say, after you finish putting this structure in place, we will make sure it is functional by posting nurses and midwives or doctors or whoever, and providing the facilities that will make sure that these primary healthcare centers are functional. The next thing we saw that made us uncomfortable is population growth and the provision for family planning. We are growing at between 2.5 and 3% annually in terms of population growth. But of course, you know, in the last 2-3 years, our economic growth has been in the negative, or even last year it tried to grow, we did not grow up to 1%. So the population growth is outstripping the resources available. And it is time we begin to think seriously of how to plan our families. We think it's a height of irresponsibility for us to be begetting children we cannot take care of. Children we cannot pay their school fees. Children we cannot pay for their medical services. Children we cannot even feed. Children in some parts of Nigeria, their parents will not even house. They allow them to roam the streets. And this is a recruitment ground for extremist violence and views. So we should have proper population control, and the government should lead the way by making enough provision for family planning. We have what is called the costed implementation plan of the Nigerian Family Planning Blueprint, which says how much Nigeria should be investing every year. And Nigeria also went to the London Summit and made some commitments on the amount of money they will be investing in this transaction on a yearly basis. In terms of nutrition, there's the national strategy and plan on nutrition, which also costed how much the government should be putting in. Yes, we are collaborating and coordinating with UNICEF. And the federal government promised to provide a minimum of $10 million annually, so you convert it to Naira. And we did not make that such provision. in the 2018 budget provision. And then we have omnibus provisions that need details. Look at one. Strategic purchase of a guaranteed package of preventive, promotive, and curative care for Nigerians, and the provision of operating budgets to PAC, fair electronic transfers, under the Basic Healthcare Provision Fund. Ladies and gentlemen, you will agree that this thing has no meaning. It is clearly an attempt to deceive the uninitiated. 3 interventions that are necessary in healthcare: preventive, promotive, and curative. We are all budgeting for them in one. Just some technical jargon that nobody can even talk about to say this is the meaning. And you are linking it up to electronic transfers. This is becoming another e-wallet for fertilizer that we used to have in the days of Advocacy. You know? So this needs unpacking. And there are so many provisions where you don't know the goods, works, services, construction or deliverables that the vote will be used for. Assuming you were to go to the Ministry of Health or National Primary Healthcare Development Agency to ask for this, what will you be asking for? You must understand what the vote should be for before you begin to say, I'm going to monitor or to track. Now, HIV/AIDS also received the paltry votes. Only a total cost of 1.418 billion. And they said that we are going to do at 50,000 per person for 60,000. If you even multiply that, it doesn't give you the money they put down there. 50 by 60 should give you not less than 3.something billion. And we are saying that there is a gap, a national treatment gap of 2,350,000 Nigerians living with HIV/AIDS that are not yet on treatment. So if we are serious about treating them at the right to life, we need to increase the vote for this. And we also looked at the budget of NACA and noted with regret that they simply had only 4.268 billion to contend with. Out of it, 749 million went for personnel, which is 17.57%. Procurement of antiretrovirals is taking 2.22, which is only 52%, whilst the sum of 1.293, which is 30%, is going to administrative issues. I don't think this is the proper way to budget. Administrative issues after payment of salaries shouldn't have taken more than 10-15%. So this is not the way to spend the money that they should have used to take care of people. The other challenge is the one of vehicle-vaginal fistula, where Nigeria contributes about 40% of the world total of 2 million people. That's roughly about 800,000 patients. And it's endemic in the states of Sokoto, Kebbi, Kano, Katsina, Plateau, Ebonyi, and Akwa Ibom states. These patients lose their human dignity, live a substandard life, and are even at the risk of losing their lives because nobody wants to associate with them. So we are saying that from an investigation, 100,000 could do for surgery and remediation and rehabilitation. And if you look at these figures now, that will be up to 80 billion. We are saying that the federal government may not have the money to do it at once. They could, over a period of 6 years, start making a provision of 15 billion per year and phase it. So we are demanding a minimum investment of 15 billion for that for the year 2018. Of course, some projects are repeated without background information. From 2017-2016, you see them being repeated. And we are saying that the proper thing to be done is that even at the budgets of some states at that level, what they do is that if, for instance, 2018, they are voting for the purchase of this mic, the sum of 1 million. They will tell you that in 2017, they made provision for, say, 500,000. Out of that 500,000, say, 100,000 have been released at the time of preparing the budget. So you have a little history of the trajectory of the project. Rather than telling you project is ongoing and you put a sum of money, nobody can track with the previous expenditure. Of course, donor and counterpart funds are in the budget. Okay, for various line items. Counterpart funds, particularly, we are saying we are going to pay counterpart fund to UNICEF for global fund, ATM, counterpart funding. But what the donors are bringing is not articulated in the budget. And that also makes it easy for us to know whether we are not doing double counting, whether somebody is not using the budget to pay for what already donors are paying for. So we need more transparency, accountability in the budget by making sure that these things are properly documented so that we know who is paying for what. Because we've had stories of some government agencies where the state government will pay for something, another agency will claim to have paid for it. So somewhere along the line, money gets mismanaged. And beyond the 2018 budget, this is very important and critical, because we are not simply thinking of now alone. We are thinking of moving forward. And that's why what we are thinking of is more of domestic resource mobilization. I believe that there are a lot of resources in Nigeria which could be channeled to the healthcare industry and which have not been mobilized. And all you need is vision with plenty of mission and the charismatic leadership in charge of the health ministry for us to take up these things. One is that the National Health Insurance Act should be amended to make public and private health insurance compulsory for every Nigerian who earns up to the minimum wage. We've made this point several times. If we are ready to pay insurance for Tokumbo vehicles and you cannot put it on the road without the police or the Federal Road Safety Corps arresting you and giving you a ticket, what are we doing with our lives? Our health is more important than that car. So it should be compulsory, and by the time we do it, we have a very huge pool of funds running into trillions where subsidies could be done. Those who are poor can take benefit of it, or those who are sick can take benefit of it at the time they are sick. It reduces the out-of-pocket expenditure for ill health, because nobody can predict when he will fall ill. By the time the person is ill, they are demanding money, you may not have the money right away. So that's why we are saying this should be done to mobilize resources. We are also calling for public-private partnerships in health services, because a number of companies could actually adopt hospitals or PSCs and maintain them, have their logo put on them. There are also public-public partnerships where you have the big NMPCs, the CBNs, and the big federal companies that have a lot of resources. They could also be made to fund the health sector. Now, we also have recommended the Nigerian Immunization Trust Fund, which is a special fund to fund immunization in Nigeria considering its critical nature. We are as well advocating for a health bank of Nigeria. The idea of a health bank of Nigeria is to deepen health financing and to provide funds for the health sector beyond budgetary allocations and money from the National Health Insurance Scheme. The bank is to focus on funding for the development of hospitals and other health institutions, human resources for health in terms of giving out student loans for the acquisition of rare and advanced competencies in the medical sciences, health infrastructure funding, and for research on key topical diseases and medical conditions prevalent in epidemiological analysis. The bank will also be involved in providing loans for drugs and health hardware and software manufacturing institutions and firms. Essentially, the health bank will be set up to respect, protect, promote, and fulfill the enjoyment of the right to health. It will give out single-digit interest loans or loans at rates below that which is available in money deposit banks. The loans will be long-term in nature with a long period of amortization. The bank will not necessarily be set up for profit, but in furtherance of the right to health. However, it is not expected to be loss-making. It should be self-sustaining and earn incomes and profits at a rate below the prevailing market rate. The initial capital should be subscribed to by the federal government through the Central Bank and Ministry of Finance. Regional and international development banks such as the African Development Bank and World Bank will also be called upon to subscribe. So here is a summary of our recommendations to the legislature. To progressively increase the vote for health, particularly for maternal, newborn, and child health, to at least 50% of the Abuja Declaration, which is 7.5% of the overall budget, and calculating it for 2018, it comes up to 645 billion. Savings made from frivolous, inappropriate, and wasteful expenditure proposals should be reprogrammed to MNCH. Center for Social Justice has documented this in another booklet, which we are saying whatever savings, rechannel it there. Make provisions for the Basic Healthcare Provision Fund, which is 1% of the Consolidated Revenue Fund, and for 2018, it is in the sum of 56.866 billion. Make full provision for any funding gap in immunization, and after 2018, discontinue the practice of funding immunization with borrowed funds. This will involve enhanced domestic resource mobilization, and that's why we are calling for the Nigerian Immunization Trust Fund Act. only approve investments in primary healthcare centers if the executive provides evidence of a memorandum of understanding with the states and local governments where the primary healthcare centers are located. Such MOU will show the commitment of the states and local governments to fund the recurring component of the expenditure after the capital vote from the federal government has been expended. Increase the votes for nutrition to meet the funding gap. As a minimum, provide for the annual investment of $10 million, which amounts to $3 billion, 50 million, under the health sector component of the National Food and Nutrition Policy. We are also calling for increases for family planning in accordance with Nigeria's commitments at the London Summit and the National Family Planning Scale-Up Plan 2014. Again, the vote for HIV/AIDS should be increased, with special attention dedicated to the health of mothers, newborn and children, and prevention of mother-to-child transmission of HIV/AIDS. Increase the vote of the midwife service scheme by 280 million to bring it up to 1.280 billion. Of course, we talked about provision for VVF patients as a minimum, 15 billion for the year 2018. Consider an amendment to the National Health Insurance Act to make public or private health insurance compulsory. The text steps to set up a Nigerian immunization trust fund for the sustainable funding of immunization in Nigeria, and consider the establishment of the Health Bank of Nigeria to provide a new window of capital for sustainable funding of health investments. All these are for the legislature. To the executive, provide full details of clear and omnibus provisions to indicate the goods, work, services, or construction that votes will pay for, and the deliverables to be expected by the citizens. 2. In the future budget preparation, craft the budget in such a way and manner that provides full details of previous votes, releases, and utilization for ongoing projects as a guide for understanding of current provisions. The budget should be accompanied by an MNCH framework and provisions in terms of expected outputs and outcomes, and full provision on donor and counterpart funds in the budget. To our colleagues in civil society, they should continue effective networking, coalition building, and advocacy, focusing on key issues of capital concern to the health and maternal, newborn, and child health sector. Monitor the implementation of MNCH budgets nationwide. Advocate for full and timely release of budgeted funds. And finally, mainstream maternal, newborn, and child health and the right to health into the political election agenda towards the 2019 elections. So, ladies and gentlemen, this is our policy presentation.
Thank you very much. In addition to what we had.